Okay, let's start. So we're gonna talk about like the medication administration today. So because Diana, you work as a nurse in the hospital.
Yeah.
Okay, so as a nurse, we will need to understand our scope of practice when we give the medication to our patient.
Yeah.
So our topic today will be how to administer medications to patient on the nursing work, and what are some responsibilities for us to follow. Okay,
Okay.
so that's our topic. Medication medication administration. So when we talk about administration, do you understand what means administration? This word.
I'm sorry.
So administration means to give.
To give.
Yeah. So administration means to
Yeah.
give.
Okay.
Okay. So that means when we say medication administration, that means we need to give the medication to the patient. Okay. So this is a very important job for the nurses to do. So when we give medication to our patients, what we need to follow the doctor's order. Okay, so the first thing we need to understand is, as a nurse, we don't order the medication. That's doctor's job. Okay, so firstly, doctor needs to review the patient, and then doctor will decide what medications that this patient needs to have. And then doctor will write the medication order on the medication chart. Okay? So, firstly, medication order. Okay? So, medication order needs to be given by the doctor. Yeah. And then as a nurse, we need to follow this medication order. So, where does doctor write the medication order? On the medication chart. Yeah, medication chart. Okay, so first stage is the doctor review the patient and then write the medication order on the medication chart. And as a nurse, we will need to follow this medication chart. So nurse needs to follow. Okay, follow the medication chart. Nurse will administer the medication according to this medication chart. Okay, medication chart is a paper. Okay, yeah, it's like a form. So doctor will write the medication order on this medication chart, and when we give the medication to our patient, we will need to look this medication chart, find the order, and then follow this order. Is that clear?
Okay.
Yeah. Okay. Understand?
Yeah.
Very good. So this is the first step. And then secondly, so when we administer the medication, that means to give, right? Before we administer, there are a lot of things that we have to consider. So before nurse administer medication to the patient, there are a lot of things we have to check. So next thing we're going to talk about what things to check. Okay, so we need to remember there are 8 rights, 8 rights, and 3 checks. 3 checks. Okay, 8 rights. 8 rights means there are 8 things you need to check. Yeah, to make sure that the patient received the right medication and patient is safe. Okay, so what are the 8 things that we need to check to ensure a safe administration? So we need to clearly remember this. The first thing is we need to check the name of the medication. Okay, so look, for example, this is medication, right? So we need to check the name of the medication. So medication is normally stored in this medication bottle. So we need to look the medication bottle and then have a look the name. What is the name of the medication? And then check the root of the medication. So 8 rights include name of the medication, name of the. We can use a short term. We can use MAS. MAS means medication.
Okay.
So firstly, check name of the medication, and secondly, check the root of the medication. Root. So ROUTE. Root of giving medication. Yeah. So what means root? Do you have any understanding?
Root is
Route means the way to give the medication. Yeah, the way to give, how we give medication. Now, when we talk about the route, there are different routes that we can give the medication. For example, the most common route is oral. Oral. So oral means you give through the mouth. Yeah. So when we talk about the route, there are different types. For example, the oral medication. Oral means give the medication through the mouth, and this is the most common type.
Okay.
Or we can give the medication through the muscle, like injection, isn't it? We can give injections through the muscle, or we can give the medication through the blood vessels, through the vein. Yeah. Or sometimes some medication can be given as a cream, like a cream, you know, understand, like lotion or ointment. This medication can be applied on the skin, and the skin can absorb medication. Okay, so there are different routes, and we're going to discuss this later. Okay, so firstly, let's understand what is route. So route means the way of giving the medication through what ways that we give. Okay, and next thing we need to check is when you look the medication bottle, next thing we check is the expiry date of the medication. Okay? Expiry date. Expiry date. Okay, of the meds. Yeah. Expiry date. What is expiry date?
Must be used before the expiry date.
Yeah, so expiry date of medication means before what time the medication is effective. Okay. Yeah. So on the medication container, there's always a expiry date printed there. Okay. So you need to look the expiry date to make sure that this medication is not expired. Expired means out of date. Yeah. After the expiry date, if you see, for example, the expiry date, it says August of 30 of August 2023. So it's not expired because now it's July, isn't it? So August is next month, so it's not expired. So that's fine, you can give. But if the expiry date says the medication expires May of 2023, now it's already July, so it's past May. So that means we cannot give anymore. Okay? Yeah. So we check the expiry date of the medication.
Okay.
Yeah. Now what else we need to check?
I think
we have to also check the dose of the medication. Dose. D-O-S-E. Dose of the med. Okay? Dose. Dose means how much medication you give to this patient. The dose. Now, most oral medications, like it's stored in this bottle. It's like a tablet, in a tablet form, isn't it? A tablet means like a little formed pill of the medication, right? So the dose means how much medication you need to give. For example, on the medication tablet, you're gonna say it's 5 milligram or 10 milligram, it's 20 milligram, like that. So that's a dose. So how much medication you need to give to this patient. And when the doctor write a medication order, the doctor will write the dose on this chart, on the medication chart.
Okay.
Yeah, write the dose. Doctor will write the dose, the name of the medication, yeah, all these details on the medication chart. Okay? So you need to look the medication chart and make sure, yeah, you give the right dose of medication. You need to follow that order. Is that clear?
Yeah.
Is clear?
Yes,
Yeah.
yes.
So this is the next thing we're gonna check.
Yeah.
What else we need to check? Name of medication, route of the medication, expiry date, dose of medication, and also we need to now when we bring this medication to the patient, we need to also check the patient, isn't it? To make sure that we have to make sure that the right medication needs to be given to the right patient. Yeah, for example, the doctor write medication paracetamol for this patient called Michael. So you need to give this medication to Michael, not another patient, yeah? So you need to make sure that the right medication to be given to the right patient. So I have to check the name of the patient. Name of patient, okay? So make sure the right patient receives the right medication, because actually sometimes medication error does happen. So sometimes if we forget to check, we probably give the wrong patient the medication, right? And that can cause serious trouble. Okay? So check the name of the patient. What else we have to check?
The time.
Time, very good. Yeah. Time of giving the medication. Yeah. Very good. Now we have to check the time of giving the medication. So normally when the doctor write the medication order on the chart, the doctor also will write the time that the patient should receive this medication. Okay? So we have to compare the time with the time written on the medication chart to make sure they both match. Yeah, the time when we give this medication must match the time written on this medication chart. This is clear, yeah? Yeah. For example, doctor write the patient needs to have this medication at 8 o'clock. So you have to give this at 8. Can you give at 9? No, you have to exactly follow the time. This is very, very important. Yeah. The time of giving the medication, very good. So now we have 1, 2, 3, 4, 5, 6. What are the 2 things? As a nurse, think about, as a nurse, after we give the patient medication, what we have to do immediately?
This document.
Document, very good, yeah? So write documentation, yeah? Write documentation. So that means after we give the medication to the patient, to keep an evidence, we have to sign our signature. Yeah, we have to sign our signature on the medication chart under this medication order to show that we indeed give this medication. Okay? Yeah. Otherwise, no. Remember one policy: no signature, no evidence. Yeah. If there's no evidence, nothing can prove that we did give this medication. Okay? So make sure that you sign your signature immediately after you give this patient medication. So write documentation. Document. Very good. And the last thing. Now we talk about 1, 2, 3, 4, 5, 6, 7. Last, right. What is the last thing? Right. Patient has the right to what? The right to. Patient can. Remember, before we give the patient medication, we have to what? Get consent. Can we force the patient to take medication? No, we can never force them. We can only ask, are you okay for me to give you this medication? And the patient says yes, then we can go ahead. If the patient says no, we cannot force them to accept. So the last thing is right to refuse. Okay.
Okay.
Right to refuse. Yeah. This is very, very important because
Okay.
in Australia, especially, maybe different, depending on which country you work in. Yeah. In Australia, we can never force our patient to accept nursing care. Okay.
Okay.
Yeah. So patient has the full right to refuse any medication.
Okay.
If the patient says no, I don't want this, I don't like the taste, like that, and if the patient insists to refuse, then we have to accept it.
Okay.
Yeah, and then but we have to report to doctor and RN
Okay.
to let doctor know that this patient refused.
Okay.
And we also have to explain to the patient that if he or she refuses, what would be the consequence? So for example, if the medication is really important, but the patient keeps refusing, then we have to educate our patient. We have to say this medication is very important for you. I cannot force you to take it, but I have to let you know that if you don't take it, some problem going to happen, and that will be your own responsibility. Okay, so the patient, you have to tell the patient what could be the outcome, what could be the consequence. If he doesn't take it, what's going to happen, and then report to doctor, and then document as well. So if the patient refuses to take medication, now when you document on this medication chart, you don't sign your signature, but instead you write a R.
R.
Yeah,
Okay.
and put a circle around.
Okay.
So R means refuse. Okay.
Okay.
Yeah. You have to let doctors and other nurses know that this patient actually refused it.
Okay.
Okay. And then the doctor needs to review the patient and maybe give some alternative options. Maybe doctor gonna write some other medication with a similar effect, or maybe the doctor gonna to investigate and find out why the patient refused, and maybe use some other ways to maybe the patient doesn't like the taste of this medication. So we could tell the doctor, and doctor use another medication with a better taste. Okay, so we have to find out what are the reasons that this patient refused.
Okay.
As a nurse, we also should ask. For example, a lot of cases, some patients they are scared of needle. So that if you give them injection, they're scared of needle. They have the needle phobia. Yeah. So they don't like to be jabbed. Yeah. So in this case, maybe we can report to doctors that this patient is very scared of needle. Maybe we don't give them the injection. Maybe instead we give some oral medication. So that makes the patient feel more comfortable. Yeah. So this is right to refuse. So now these are all the 8 rights we have to check. Yeah, before we give any medication to the patient. Okay.
Okay.
So make sure it's right medication. Check the name of the medication. Make sure it's the right medication. Right route to give the medication. So route means how do you give? Yeah, by oral, by mouth, or by applying the skin, or if it's like injection, inject the needle like that. So there are different routes to give. Okay, and also make sure they have the right expiry date. Make sure the medication is not expired. That means out of date. Okay, and also we need to check the dose of medication. Yeah, strictly follow the correct dose. Make sure we give the right dose. If it's a 5 milligram, we give the 5 milligram, all right? And we have to match the dose with the medication chart. And also check, when we come to the patient's bedside, we have to check the name of the patient, make sure we give the right medication to the right patient.
Okay.
And check the time of giving the medication. Make sure we follow the time written on the medication chart. If it's 8 o'clock, we give at 8 o'clock. If it's a 9 o'clock, give at 9 o'clock. We cannot give the medication at a different time.
Okay.
And make sure after you give the medication, sign your signature on the medication chart.
Okay.
Yeah, right documentation. And lastly, remember the patient always have the right to refuse. We cannot force them to take. Understand? So this is our major scope of practice when we give medication.
Okay. Okay.
And also we need to know 3 checks. Yeah, we talk about 8, right? And then we also have to talk about 3 checks.
Okay.
So 3 checks means there are 3 times you have to check this medication.
Okay.
Yeah, the 3 times. So when you get the medication from the medication shelf, because like if you work in the hospitals, there is a medication storage room. So all the medications are stored in this medication room. Okay, so and this room cannot be accessed by anyone. Okay. So only medical professionals like nurses, doctors have the ID card, and they can use ID card to swipe the door, and they can access this medication room. But not all the people can access this medication room. Okay, so only you have the as a nurse we have the right to get medication from this medication storage room. So when we get the medication, we need to follow 3 checks. That means we have to check 3 times. When the first time is when we remove the medication from the medication shelf in the medication room. Yeah, we have to check this medication. Yeah, have to check medication. Look and compare this medication with the medication chart. Yeah, compare both and see it's right. And then after we prepare the medication, okay, then when we remove this medication from the medication bottle, yeah, because medication is stored in the bottle, isn't it? So when we take the medication out from the bottle, we have to check again. Yeah, check again, because sometimes sometimes in the medication bottle, maybe the tablets, the medication tablets is not the same as written on the bottle, isn't it? So you have to. So when you pour this medication out, when you take the medication out from this bottle, you have to again check the medication, make sure it's the correct one.
Okay.
Yeah, make sure it's the correct one. Check the color of the medication, the form of the medication. Make sure that it's definitely that medication. Okay. And the 3rd check is you take the medication to the bedside, to the patient's bedside. Yeah, at the bedside of the patient. So before you give the medication into the patient's mouth, you have to again check again, do a final check to make sure this is really the correct medication that we give to our patient. Okay. So these are the 3 checks. So 3 checks means there are 3 times you have to check the medication before you really give to the patient. Yeah, so remember, when we remove the medication bottle from the medication shelf, check it. When we take the medication pill from the medication bottle, yeah, check it. Yeah. At the patient's bedside, before we give to the patient the medication, check finally to really confirm we are doing the right thing. Okay? Yeah. So these are the 8 right 3 check. All clear?
Okay.
Yeah.
So check. Okay.
Yeah. Okay. Now there are several more things that I wanted to discuss as well. Okay. Another very, very important thing. Yeah, there's another very important thing that we have to remember as a nurse. Okay, before we administer the medication to our patient. Yeah, before we give the medication to the patient, one more thing we need to ask is, do you have any allergy? Okay, allergy.
Okay.
Yeah.
Okay. Allergy.
So allergy.
Okay.
Could you tell me what means allergy? What is your understanding about allergy?
Just take some just allergy means allergy to some medication or some.
Yeah, when you say allergy, that means you're allergic to something. That means whenever you have this thing, whenever you take this medication, you could have some adverse reactions. Yeah, for example, some patients they're allergic to some certain medications. So once you give this medication to this patient, the patient might feel nausea, the patient might have rash on the body, the patient might feel short of breath, you know. So allergy means you can have some side effects or adverse effects after you take this thing. Okay? Yeah. So make sure that before you give the medication to your patient, ask your patient, do you allergic to this medication? Do you have any allergy?
Okay.
Yeah. Do you aware of any allergy? Okay?
Okay.
Yeah. So make sure the patient is not allergic to medication. If the patient says, yes, I'm allergic to this medication, then you cannot give. You cannot give, okay? And you have to report to doctor.
Okay.
Now, another thing is that because we have to follow this medication chart, isn't it? It's a medication chart. And doctor write a medication order on this medication chart. So normally on the medication chart, there's one section. On this section, the patient's allergies will be written on that section. Okay? So on this medication chart, patient's allergies should be written, on the top of this medication chart.
Oh, okay.
So normally initially when the patient is admitted to the ward, doctors and pharmacists have to come to review the patient's medications. Okay. Remember when we talk about admission, so whenever we have a new patient come in, so as a nurse, we need to inform the pharmacist, right? Pharmacist. So pharmacists are those people that are specialized in medication. Yeah. So we firstly inform the pharmacist. So the pharmacist is gonna come in and to review patients' medications, and then the pharmacist is gonna to ask a lot of questions and then ask patient about their allergy and then write patient's allergies on the medication chart to alert everyone else. Understand?
Yeah.
So that's like allergy. Allergy is very important, we ask. So normally pharmacists actually firstly review medications and find out the patient's allergies. Okay? Do you understand how to
yes.
pharmacist, yeah?
Yes, and
Pharmacist. Okay, so this is a very important word. Pharmacist. So pharmacists, they are the professionals that work in the hospitals who is responsible for managing the medications. Yeah, so pharmacists, they help the patient to supply medications. They give the education about medication to our patients, and they also they can teach the staff about how to give some medications like that. If we are not familiar with some medications, we can consult with pharmacists because they have really good understanding and knowledge, very deep knowledge about medications. Okay, so this is very important now. So allergy must be asked. And also some other things. There are a few other things that I want to mention at the end. Okay. After we give the patient medication, so after we give, after administration, there are also some things we need to be aware of. Okay. Now understand about this word, isn't it? What does this word mean? Tell me.
Means as a nurse, how to give for patient medication.
So when we say medication administration means what?
How to give.
To give. So when we say medication administration means give medication to the patient. Okay? So administration, this word is really important. So after we administer the medication, after administration, what should we do as a nurse? Okay. So firstly, we have to keep monitor our patient. After administration, we have to monitor monitor patient. Yeah.
Yeah.
Monitor patient means that after you administer the medication, you don't just leave the patient there. Okay.
Okay.
You have to keep monitoring the patient to find out whether they can have any side effects. Yeah. What do you monitor? Side effects. Side effects. What is side effect? Side effect means something that some effect that we don't want. So most medications can cause side effects. So side effects means some signs or symptoms that the patient could show after they have the medication. So medications can cause some like harm for the body. Okay.
Yeah.
So a lot of medications have side effects. They could actually make the body, like become uncomfortable. Okay. But they could cause some, like adverse reactions. Okay. So side effects means something that could happen that we don't want.
Okay.
Yeah. After we give the patient medications. Okay.
Yeah.
So most medications could cause some kind of side effects. The bad effects.
Okay.
Yeah, they could cause some kind of harm to the body. But the level is very different. So some medication can only cause very mild side effects, but some medication can cause more higher level of side effects. So the level is very different. Okay? That means the side effects means that when after the patient have this medication, the patient could feel uncomfortable.
Okay.
Yeah, the body could show some symptoms. The patient maybe not, cannot tolerate this medication properly. The medication can trigger some bad results. Yeah, understand? Can make the medication can make the patient feel a bit uncomfortable.
Yeah.
Yeah, but with different level.
Okay.
With different level.
Okay.
Yeah.
Different.
Yeah, so this is called a side effects. Yeah.
Side effects.
Yeah.
Okay.
Now, for example, some medications can make, after you take it, some medication can make the patient feel nausea.
Okay.
Some medication can make your, can make you have an, uncomfortable stomach. Some medication maybe can make you to have a diarrhea. Some medication can make you feel dizzy. Yeah, that there are different kind of side effects the medication could trigger. Okay, so different medication could have different kind of side effects, and the level are very different.
Okay.
Yeah. And some medications can make you, drowsy, can make you become more sleepy. Some medication can make you, can make you have like constipation. Yeah, like there are all different kind of side effects. Okay. Yeah. So this is side effects. So we have to monitor the patient.
Okay.
We have to monitor the side effects to find out whether the patient feel uncomfortable and what side effects it can cause. Okay.
Okay. Okay.
If the patient has shown any signs and symptoms, for example, if the patient said, "I feel quite dizzy after you give this medication to me," I feel unwell. Yeah, that means it could have side effects. Then you have to report to RN and doctors, so they have to review. Yeah. Okay. Yeah. This is very important. So this is about monitor the patient continuously after administration. Okay. And if you want to know, the details, you can do the vital signs, isn't it? Yeah. So some medications, if the patient feels dizzy, some medication maybe can drop the blood pressure.
Okay.
Then you have to get a vital signs machine, check the patient's blood pressure. Yeah. So do a set of vital signs. Yeah. Vital signs. Yeah.
Okay.
Vital signs include like blood pressure, heart rate, temperature, respiration rate, like those. Yeah. So check the vital signs after you give the medications, especially those important medications.
Okay.
Yeah. Okay. Now just two more little things to talk about. Now we know that not all the patients can swallow the pills properly, isn't it? Now some medications, for example, Panadol, paracetamol, the medication pill is very big. The patient cannot swallow. Yeah. So what you should do? Crush it. Very good. Yeah. So some medications we have to crush. That means we make it into powder. Yeah, we crush it.
Yeah.
Because some pills are very big, so the older people cannot swallow it properly. So crush it into powder. And what we can mix the medication powder, because the taste is very bitter. We can mix the medication powder with what? With some jam, like jam. Crush with like jam, like honey, isn't it?
Yeah.
Honey,
Yes.
or
some cream, some like a cream.
yogurt,
Yogurt.
isn't it? Yogurt.
Yeah.
Yogurt. Yeah. Or even soup. Maybe in you work in nursing home, right? You see
yeah.
like sometimes they put in the soup, porridge, and then give to the patient. Yeah.
Mm.
Now, so some medication, if the pill is too big, yeah, especially for older people, we need to crush it into powder and then mix with either jam or honey or yogurt or soup to make the patient easier to swallow. Okay? And this is very, very important. And also, like sometimes you see like some medication pill. You see the medication pill has a color. Right?
Yeah.
Yes, like that's called coated medication. Coated. Yeah. Coated. Yeah. So some medications are coated with like those very shiny color. You know that, isn't what I mean? Coated. The medication pill, like can be red or yellow, like look very shiny, like very smooth, because the medication is coated. Yeah, coated. Yeah. Understand what I mean, isn't it?
Yeah,
the medication is covered with a coat.
Okay.
Yeah, so some medications, they are coated. So with these coated medications, remember, don't crush them.
Okay.
Yeah. If the medication is coated, we don't crush it. Yeah, we don't crush it. Yeah. Only those medications not coated, yes. Then we can crush it. But if the medication is coated with color like that, yeah, it's coated with like a cover, yeah, we don't crush it. Yeah. And some medications, like they can they can be in the form of a capsule. Capsule. Capsules, like you see some medication, they have the powder inside. It's like this. Like this, yeah?
Yes.
Like the round.
Yeah.
And in the middle, they have like this, yeah?
Yeah.
This is called a capsule. Capsule.
Okay.
Like the medication is in a powder form. The powder is stored in this capsule, in this shell. In this shell. Yeah?
Okay.
Understand?
Understand, yes.
It look like this. It look like this. Yeah?
Yeah.
Now it's clear, yeah. This is called capsule.
Capsule.
Okay. Now, when you give these capsule medications, you have to break it, open this capsule, and dip this powder out, and then put the powder into this, like into the jam or honey or something to give to the patient. I mean, only if the patient cannot swallow. I mean, yeah. If the patient can swallow the whole capsule, you can give it. But if the patient cannot swallow, open it and mix the powder with this some like jam, honey or something, and then give to the patient. Yeah.
Yes. Okay.
This is like how to give different types of the oral medications. Oral medications. Now, some medications they can swallow, but they're not very good with swallowing. But so you don't need to crush the whole medication, but you can maybe cut this medication into half. Yeah, give the small break into half, so it's easier for the patient to swallow. Okay. Yeah. So that's some like things we need to remember for the oral medication. Remember, oral medication means we give medication through the mouth. And this is the most common way of giving medication. So oral.
Yeah.
So oral route is to give medications through the mouth. Yeah, and this is the most common route. Most common route. Okay. But in our next lecture, we can talk about some other routes, right? We can have a whole lecture about different routes of giving medications. Okay?
Okay.
So understand about this. This is our first lesson. Yeah.
Yeah, yeah, yeah.
Now I'm going to ask a few questions.
Yes,
Now,
yes.
hopefully you can
Yeah.
answer.
Yeah.
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 Very easy. Yeah. Very easy topic. Yeah. So firstly, yeah.
Yeah.
So our topic today is about medication administration, especially the oral medication. Yeah. Oral medication. Now tell me what means oral.
Or means give medication to give patient mouth.
Give medication through the mouth.
Through the
Yes,
mouth.
Through the mouth. Very good. Very good. Now there's a short term for oral. We can say PO.
Okay.
On the medication chart,
Okay.
doctor can write PO.
Okay.
So PO means per oral. Per oral.
Per oral. Okay.
Yeah. So per oral. So doctors sometimes they don't write the whole word, right? Doctor when they write the root, they will just write PO. That means
Okay.
oral. So if you see PO, you know that's oral. Give the mouth.
Okay.
So per oral. Very good. Very good. Okay. Now when we say administration, what does this word mean?
Give.
To give. Yeah.
To give.
Yeah. When we say when the nurse tell you, please go to administer this medication to the patient, you know that means to give.
To give.
So administration means to give.
To give.
Okay, medication administration. So administration means to give this medication. Yeah. Now before we give the medication, what do we need to check?
We need to check doctor order.
Yeah. So
Medication order. Yeah.
very good. Medication order. So doctor first needs to order this medication.
Yeah.
So can we as a nurse order medication?
No,
we cannot. So what is another word for order?
Order is medication chart.
No, prescription.
Okay.
Prescription.
Yeah.
Now medication order must be initiated by the doctor. So only
Yes.
doctor can write medication order. So
Yes.
order also means prescription.
Yeah.
Prescription. Remember this word.
Okay.
Yeah.
Okay.
Prescription means prescribe the medication. So prescribe means order.
Okay.
Prescribe means order. Okay.
Okay.
So medication. So firstly, before the patient can have medication, doctor needs to firstly order this medication
Yes.
or prescribe. So prescription and order they have the same meaning.
Yeah.
The
yeah,
doctor
yeah.
say we can say doctor prescribe this medication
Okay.
or doctor order this medication.
Okay.
They have the same meaning. Okay.
Okay. Okay.
Yeah. Now where does the doctor write the order or the prescription? Where does doctor write?
Medication chart.
Very good, yeah. So firstly, we need to have the medication prescription or the order. Now this order or prescription must be written on this medication chart.
Okay.
Medication chart.
Yeah.
Very good.
Thank you.
Now as a nurse, what is our job? To follow
Follow
this
this
chart,
chart,
isn't it?
yes.
Yeah, so when we have medication order or prescription, now then we need to look this prescription on the medication chart and then go to follow it. Gonna follow it and then give the patient medication. Yeah.
Okay.
Yeah.
Okay. Okay.
So if there's no medication order, no medication chart, we cannot give medication.
Okay.
Yeah. So we must make sure that the medication is properly written on the medication chart, okay, by the doctor.
Back.
When the doctor orders this medication, the doctor has to sign a signature as well.
Okay.
Yeah, when the doctor write any order or prescription on the medication chart, the doctor needs to sign their signature.
Okay.
Now, if you look this medication chart and you see this medication order, but there's no doctor's signature, can you give?
No.
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 You need to make sure the doctor signed the signature on this medication, under this medication order.
Okay.
So to keep evidence, then you can follow it. If there's no doctor's signature under the medication order,
Yeah.
on the medication chart,
Yeah.
you cannot give. Okay?
Okay.
Yeah,
Okay.
very important. Because if you give the wrong medication, if you give it but actually doctor didn't order it, and you give it, there's no signature, there's no evidence. So if there's some like problem later, you will be fully responsible. Okay? Yeah.
Okay.
So really, this is really important
Mhm.
as our nurse job. So after we confirm the medication order on the medication chart, then we can follow it and then we can give. Okay?
Okay.
Then we can give. And then remember, we talk about the
Mhm.
8 rights and 3 checks. Isn't
Okay.
it? So
Okay.
now before we give the medication, before we administer this medication,
Mhm.
we need to check the 8. We need to
Eight.
check the 8 rights.
Rights.
Yeah. So what are the 8 rights we check?
The first is medication name.
Yeah.
Yeah.
Name of the medication.
Of the
Make sure the right name of the medication.
Yes.
Next one.
Next one is route.
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 Very good. Right route of
Right,
medication.
route. Yeah.
What means route?
Route is means which way you give the medication.
Very good. How do you give? Yeah, by oral or it's like on the skin or it's like on the injection, you know. So check the right, make sure it's the right route of the medication. The route, how do we give? Okay, yeah. And then
And then dose.
dose. Yeah, dose means, what is dose?
Dose means is how many you give.
How many pills, isn't it?
Yeah,
How
yeah.
much? Yeah, so check how much dose we need to give to this patient and strictly follow the medication chart. Okay?
Yeah.
So check, make sure it's the right dose of the medication. Anything else?
Just the
Expiry date.
Yeah.
And also check the expiry date of the medication. Make sure the medication is not expired. Yeah, check the expiry date.
expiry date.
And then
And then just with the we have to check patient's name. Give a right patient.
right patient. Very good. Right name of the patient. So when you come to the patient, now before you give this medication, you have to ask patient, what is your date of birth? What is your full name? Yeah. Make sure the patient verbally tell you, yeah, what is your date of birth, what is your full name. So make sure you check the ID of this patient. Yeah, make sure we give the right,
Patient.
medication to the right patient. So right patient. Yeah. Anything else?
And right time.
Right time
Right
to
time.
give this medication. Yeah. If at 8 o'clock, we have to give at 8 o'clock.
Yeah.
We have to strictly follow the time
Time.
on the medication order. Okay. Yeah. And then last one. Last 2 things.
Right documentation.
Right documentation. So after you give this medication, we have to sign our signature to show that we did give. Okay. And then the last one.
And the last one is patient can refill.
Refuse. Yeah. Right to refuse. The
Right.
patient have to right refuse. So you have to really get the consent. So before you give the medication to the patient, you have to ask patient, do you agree for me to give to you? Okay. Now you have to give some education, isn't it? You have to educate the patient. So patient could ask you why I should have this medication, why I have this, what this medication is for. You have to have good knowledge. You have to tell the patient, oh, you need to have this medication because you have pain, and this medication can reduce your pain. This medication can help you, can make your blood pressure keep a stable level. Yeah, this medication can make you feel less dizzy. You have to tell the patient why the patient has to take this medication. Then the patient can be more likely to accept, isn't it? Yeah. But if the patient still refuse, insist to refuse, you cannot force them, isn't it? You have to accept and then report to doctor. Yeah, very good. Yeah. And also we talk about 3 checks. There are 3 times we have to check the medication. Yeah, still remember.
When they going to the shelf to get the medication, they have to check the medication name.
Yes.
And then when we get the medication
From the bottle. When we
from-
when we take the medication out from the bottle,
out,
we have to check it.
check.
And then
we have to check. We have to get and then
check before we
Okay.
give to this patient, when we stay at the patient's bedside,
yeah.
when we bring the medication to the patient's bedside,
Yeah.
before we give to this patient, check again.
Okay.
Yeah, so 3 checks.
3 checks.
So altogether 8 rights and 3 checks.
Okay.
And what else we need to ask patient, especially before we give?
Allergy.
Allergy. Always remember, before you give this medication to the patient, ask patient, do you have any allergy?
Allergy.
Yeah. Are you allergic to any medication? I'm gonna give you this medication. Can you tell me, are you allergic to this medication? Okay? Yeah. Check the allergy is very important. If the patient is allergic to this medication, can you give?
No.
No. What you should do?
We have to just tell RN or and the doctor.
Yeah, quickly inform RN. Doctor said I can't give this medication because patient is allergic to it. So doctor needs to come and change the order. Change the order. Okay? Yeah. So very important. And then later on we discuss about, if the patient have trouble of swallowing, we can crush it or break into half. Yeah. And then how do we prepare? Okay. So that's all the topic for this lesson.
Yeah.
All good?
Yeah.
Understand? There are a few terminologies I want you to clearly remember. Yeah.
Okay.
The first one is administration.
Administration.
Yeah. Administration.
Administration.
Very good. Yeah. So that means to give, isn't it? Give medication. Next one is prescription. So pronounce it. Prescription. Yeah. Prescription. Yeah. Prescription. Yeah. So this is same as order. That means, so when we say doctor so when we say prescribe means to order. Yeah, prescribe. When we say prescription, that means it's an order. Yeah. So you should firstly have the medication prescription. Yeah. Who prescribe medication? Doctor. Yeah. Doctor. We can say doctor prescribe this medication, or doctor give the prescription of this medication. Yeah. Doctor prescribe this medication, or doctor give the prescription. Can you pronounce again?
Doctor prescription.
Yeah.
This medication.
Prescribe.
Prescribe.
Yes.
Yeah.
Doctor prescribe this medication, or doctor gives the prescription.
Doctor prescribes this medication.
Very good.
And doctor prescription.
Give the prescription.
Give the prescription.
Yes, that's right.
Yes.
So prescribe is verb. You know the different type of words.
I know.
Yeah. And prescription is a noun. Yeah. Prescribe is a verb.
Yeah.
So doctor, we can say doctor order medication, or doctor prescribe medication, or doctor gives the order, or doctor gives the prescription. Okay. And then so this is another word I wanted to clearly remember. Yeah. And then pharmacist. Pharmacist means they are the professionals that
medication.
Yeah, have deep knowledge about medication. So they supply medication to the patient. They educate the patient about the medication. So they have all the knowledge about medication. If you have any questions about medication, ask pharmacist. Yeah, very good. All good. And then make sure after you administer the medication, you have to keep monitor the patients. Keep monitor if there is any side effects. Side effects. Yeah. So a lot of medications then can have some kind of side effects. Can cause a little bit harm for the body, depending on what kind of they can make the body feel uncomfortable in different ways. So different medication can trigger different side effects. They could have different levels. Yeah, some side effects are just like mild. Some could be more serious. Depends. Depends. So keep monitoring the patient's side effects and take vital signs, especially if when you give those critical, those important medications, you have to really check the side effects and do the vital signs. Make sure the patient do not have any signs and symptoms after they have this medication. All good?
All good.
Okay.
Thank you.
I think that's all for today, everyone.
Okay, thank you.